I hope where LASIK surgery is heading is beyond where it is today in people's perception, because it's somewhat ironic that people look at LASIK today as somewhat of an aggressive approach, an unusual approach, radical approach. And what's fairly ironic about that is that we're talking about a 25-year-old technology that has been continuously refined over all these years. 4 to 5 years ago was a major leap forward with the technology, and it became all laser LASIK or blade free. And at that point, the incidence of complications or side effects or really any risk at all became as close to zero as you could ever be. So while people think about their glasses and their contacts, and people always tend to feel safe with what they're doing now, and regardless of how, quote, dangerous their glasses may be or how many infections they're having with contact lenses, we as human beings go with the presumption of we're safe here with what we're doing now. But statistically, when you look at national emergency room statistics, people have so many accidents while wearing glasses that glasses become a serious danger to the eye, even the #1 danger to the eye, because 10 times more people suffer varying degrees of permanent vision loss from glasses than they do with contact lenses. And contact lens wearers, as relatively safe as they suffer 10 times more vision loss or complications than LASIK patients do. My role in dealing with patients' LASIK journey involves the fact that LASIK is really an art and science. The technology of LASIK is really remarkable for reshaping corneas and adjusting optics of the eye. But the art of LASIK is how to prescribe the treatment so that people's visual needs are met as much as possible. And the average age of LASIK patients in the US is 38 years old, and I think our patients are probably a little bit older than that for whatever reason. And so we are dealing with the issue of reading glasses after LASIK as a major consideration, because once you get into your 40s, then there's this reading glass topic. But to me, the primary art of LASIK is how can we maximize vision at all distances, minimize any need for reading glasses or driving glasses. Because the only reason people choose to have LASIK is they are looking for freedom from glasses, freedom from their contact lenses. LASIK has become simply the most enjoyable part of my day and my career, because what makes my job fun is when patients are super enthusiastic. And while it's satisfying to help people with glasses and contacts used to be the great freedom. It used to be if we could take somebody out of glasses and give them the relative freedoms of contacts, they were ecstatic. And that's why I've always been a big contact lens enthusiast. But it just becomes stages of freedom. And then LASIK came along, now a full 20 years ago, and all of a sudden contact lens wearers could say, well, can I get out of contact lenses too? And when we're able to do that for somebody, and we take, especially if someone's struggling with their contacts, redness, dryness, inconvenience, they travel a lot or they swim a lot, and contacts don't necessarily jive with water sports that well. When we can give them the big freedom and take them out of the contact lenses, that's really when people go to speechless. So the pre-op care is fun because people are anticipating being excited. But once the surgery's done and we do the months and years of follow-up care, patients still come in even a year or two later, and they haven't lost their giddiness.